Hi and Assalamualaikum and a very good day to all of you. I would like to present our innovation project entitled Intelligent Detection of Breast Cancer or known as i-DetectBC. My name is Saifullah Harith Suradi together with Dr. Kamarul Amin Abdullah from School of Medical Imaging, Faculty of Health Sciences, University Sultan Zainal Abidin and Professor Dr. Noor Ashidi Maisa from School of Electrical and Electronic Engineering, University Science Malaysia. Do you know that the breast cancer is the most commonly diagnosed cancer worldwide among women? Based on global cancer statistics in 2020, a total of 159 countries that have been diagnosed with breast cancer and approximately 2.3 million are new cases. In Malaysia, 47.9% women with breast cancer are already at stage 3 and 4. For women, breast cancer caused the first ranking of incidence and mortality in most countries around the world. One of the main contributions is due to improper imaging tool used for the early detection. Digital mammogram can be used as an initial step to detect the breast cancer at early stage. What is digital mammogram? Digital mammogram is a low-dose X-ray imaging of breast to look for tumor or abnormalities. In addition to that, digital mammogram can also detect different types of breast cancer lesions such as benign and malignant. The detectability between the both lesions will also help to determine the survival rate of patients. However, digital mammograms are usually produced using the low exposure factors that cause a poor contrast appearance and thus will reduce the lesion detectability. Also, it can produce false negative result with approximately 22% of rate and then cause unable to accurately distinguish between benign and malignant lesions. So there are three motivations of developing i-DetectBC, which are to improve breast cancer patient survival rate, mean detection of breast cancer can be identified at the early stage. Second, to provide a fast and high diagnostic result of breast cancer detection. So clinician and radiologist can make a decision diagnostic making without any doubt. Lastly, to improve quality of life, mean patient or radiologist can live without stress or keep thinking about the breast cancer effect. Therefore, an innovation is made called Intelligent Detection of Breast Cancer or i-DetectBC. The i-DetectBC is an interactive tool that can improve the diagnostic efficiency of radiologists or clinicians when reading digital mammogram. Besides, i-DetectBC can automate the detection of breast cancer at early stage. The intelligence of this tool is able to identify different types of breast cancer such as benign or malignant. There are three advantages of i-DetectBC. Firstly, is user-friendly. So any clinical student or healthcare professions can use this tool. The i-DetectBC use low computational method which can reduce cost and burden for computer system. Lastly, it is a fast tool for diagnostic which can get the fast diagnostic result, thus can reduce clinicians' workload and time consuming. How i-DetectBC works. Firstly, insert the digital mammogram from the database. Then, click the Enhance Image button to enhance the low contrast of digital mammogram. Next, click the Segment Image button to segment the region of interest and classify the type of breast cancer. And lastly, locate the location of breast cancer in the digital mammogram. For commercial potentials, nowadays the concept of intelligence is increasing to implement in the healthcare organizations such as hospital, university or diagnostic imaging center. So it can provide clinical decision support while improving the efficiency of clinicians or radiologists. For social impact and human development, the i-DetectBC can increase the survival rates of breast cancer patients with early detection. Besides, i-DetectBC could detect the breast cancer without undergo further investigation procedure such as an invasive biopsy. For this project, we managed to produce and publish 3 article journals and 2 proceedings which presented at IC Star UTN Conference, an international conference on medical and biological engineering. Through this project, we managed to win in the 3rd place for 3-minute research video for postgraduate in science and technology category and Best Oral Award in Global Health Sciences Conference 2020. For intellectual property right, we managed to submit the application, and by the time we join this event, the application is still in the process. Okay, let's see our demo i-DetectBC. First, we open the i-DetectBC apps. And then we click the select image button to insert the digital membrane for the database. For the first case, we choose the normal condition, and then we select the enhance button to improve the contrast, and then the segment button to find the lesions, and then it show that non-lesion detected. For the second case, we choose the benign conditions. And then the results show that there is benign condition in the digital mammogram. The information can show at the information box below. The last one is malignant case. Also, the apps can detect the malignant condition within the digital mammogram. So to exit the apps, click the exit button.